Alright, so we'll quickly move into um, the kidneys. So what we're trying to do is discuss all the possible, you know, medical related disease conditions of the kidneys. So the first one which we're starting is the glomerulonephritis. So in medicine, anytime you hear itis added to anything, it has to do with inflammation, right? So if you are saying acute, this thing is occurring within a short time. If you are saying chronic, this thing has been there for a while. All right. So just inflammation of the glomerulus of the kidney. Okay. And you saying acute or chronic just has to do with the time that the patient has stayed with that condition, you know. So you should know that acute is something that is occurring all of a sudden, often from infections like strep throat. Like you have infection in different parts of the body. It should now enter into the blood, get to the kidney, because almost every blood passes through the kidney. The chronic glomerulonephritis is the one that has gone small, often linked to disease conditions like hypertension, diabetes. There's too much sugar in your body. So the sugar is now depositing in the glomerulus. So over time, the glomerulus, instead of being flexible, is now becoming stiff and the rest of it. So acute forms may resolve, whereas chronic forms often lead to long-term kidney damage or failure. So for the acute, just within 1 to 2 weeks. So examples of infections that could cause acute glomerulonephritis include things like post-streptococcal infections, bacterial endocarditis, viral hepatitis, HIV, lupus, vasculitis. Your urine is becoming what? Coke colored, or they say cola colored, foamy urine, facial ankle swelling, reduced urine output, high blood pressure, fatigue, nausea and vomiting. This coke colored urine is your urine is becoming dark as a result of what? Blood. Normally blood comes to the glomerulus, it enters here. Sorry. Okay, it enters here, it gets filtered. Only your urine gets past this place. The blood goes back into the system. But if this place is damaged, everything comes and goes in. So having blood in urine. So cause can be temporary or reversible, especially in children. Complications could lead to acute kidney injury, severe hypertension, nephrotic syndrome, where you're now having proteins in urine too. Your urine is becoming whitish. So these are the different disease conditions that could affect the kidney. And one thing that you always check out for your physical examination for a patient that has kidney injuries or the flanks. Okay, you try to hit. Is there pain? Sometimes on unprovoked there will be no pain. So when you try to hit small, the patient will complain. You understand? So when we say this thing is chronic, we say that it's gradual. You know, most of the times no symptoms. The person will not really notice something to even come to the hospital. So before you know, the person is coming at the stage where everything is worse. So have things like all those long-standing autoimmune disease. So there are some autoimmune disease, right? Your body's immune system is attacking the body cells. Your immune system is very intelligent and is able to know that some cells belong to your body, so let me not attack them. But this intelligence is always controlled. So if there's anything that is disrupting that control, your body's immune system can attack the body's own cells, including the cells of the kidneys. It is like lupus, immunoglobulin A nephropathies. They also have genetic disorders like Alport syndrome, hypertension, diabetic nephropathy, like I told you guys. Okay. Over time, a lot of sugar, glucose is being deposited in the glomerulus as the blood comes for filtration. Now, the glomerulus, instead of being so flexible and meaty, over time is becoming hard and coarse. Okay. So I think that's what we got for the symptoms is often silent, no signs and symptoms. You have proteinuria, hematuria, progressive edema, you have hypertension, person is weak, muscle cramps, it leads to severe decline in kidney function, and most of the times it's irreversible. Why? Because it has stayed so much in your body and you didn't notice it quick. So early diagnosis is a thing. Okay, early diagnosis is very important. So complications due to chronic kidney disease, end-stage renal disease that will require the person to be on dialysis for life, or the only solution is what? Kidney transplant, which is so expensive to the ordinary man.